Welcome to Full Focus. I'm Gloria Penner. 20 years ago, AIDS was a death sentence. Today, advances in treatment have helped stem the death rate, and now almost 1 million people are living with the disease in the United States. But there is a downside to this success. The battle to prevent the spread of HIV is losing ground. One alarming trend is the increase of new infections among gay men, the community where AIDS was first detected. KPBS News reporter Alison St and producer Milan Kovacevic tracked the story.
I was just really shocked. I was really shocked. It was, I wanted to cry. I wanted to hurt. I felt like hurting.
Miguel Monroy is 24. He was horrified to discover last year that he'd been infected with HIV by a man who told him he was clean.
But it was a big lesson in my life because it was when I have to start taking responsibilities on my own actions. And it was my decision to have unprotected sex.
I think what's most challenging and troubling is the resurgence of risk behaviors in this community.
Dr. Chris Matthews has been at the forefront of treating HIV and AIDS patients in San Diego ever since he helped make the first AIDS diagnosis here in the early 1980s. After 2 decades of positive prevention efforts, the number of people newly infected with HIV is back on the increase.
Well, we're definitely seeing a trend. We've been tracking this over the last 3 or 4 years. It's definitely going up.
I believe it's changed a little for the worse. I think that people are taking a lot more risk now because they feel as though with technology and doctors are able to find a cure and people are living with the medications that they can be frivolous with sex, and I don't think it should be that way.
Do you have friends who are engaging in unprotected sex in ways?
Yes.
Well, you know, I yell at them all to use condoms, but I don't check what their behavior is, so you would do better.
The death rates and the hospitalization rates plummeted in the mid-90s with the introduction of the very potent therapies that we now have. And they plateaued for several years, but now they've risen again, both the death rates and the hospitalization rates, to about 60% of what they were at their peak, the beginning of the epidemic.
The virus is spreading to new communities. The rate of HIV infection is high in the Latino community and highest of all in the African American community. And women make up 10% of those diagnosed with AIDS in San Diego in the last 5 years. But the group most at risk of getting HIV remains men who have sex with men. Tari Gilbert, a nurse at UCSD's Antiviral Research Center, says the promise of the new combination drugs can lead people to believe that if they're infected, all they have to do is take a pill.
And when I first started, I was looking at the magazines, and they'd have pictures of men hiking, Mount Everest, and I can't hike Mount Everest. You think, oh yes, if I just take this medicine, I can do this. It's a fine line. You want people to know that they can live life to the fullest with HIV, but you also want them to take it very seriously. I think there perhaps was a bit of glamorization, but we do need to have a balance, because HIV is much more manageable than it used to be. However, there are many unknowns, and people can even be newly infected with viruses that are resistant to all of the medications that are available, which puts them in the exact same spot as someone who was infected in 1981.
Strains of HIV have mutated over the years to become resistant to some of the antiviral drugs. Miguel Monroy, who is one of Tari Gilbert's patients, is infected with a resistant virus.
It's resistance. This person that infected me with HIV, they didn't only give me HIV, but he gave me resistance on HIV. And what does that mean is I'm resistant to most of the drugs there for HIV. I'm resistant to 2 cocktails, and that only leaves me with 1 cocktail. But I cannot do nothing with it, because you cannot take 1 cocktail by himself. You have to combine it with 2 cocktails. And being resistant to 2 of those cocktails, I cannot take medication right now. The good thing is,
today's antiretroviral cocktails have to be taken in combination to be effective, so Miguel will have few options to fight his symptoms if they become acute. A different kind of drug led to Monroy becoming infected, crystal methamphetamine, or speed.
I was using crystal meth. I was using crystal meth at the time. When you're using crystal meth, you really don't care about things. You just do things because, you know, the move, the drugs, unprotected sex, you know, it's a high that you cannot go to sleep, and you just, like, it's really freaky, and it was the drugs.
I think that amphetamine abuse in this community is very likely the single most damaging factor to control of the epidemic, particularly among gay or bisexual men who tend to use it a lot, apparently.
Crystal, I think, can be a real problem, not just because it's so available, so prevalent, but it also increases people's sexual appetite and decreases their inhibitions. Bad combination. Very bad combination.
Casual relationships made on the internet and in bathhouses make it easier to find partners willing to engage in risky, unprotected sex, known as barebacking. But it's not only young men interested in casual sex who are engaging in risky behavior. Michael Vigorito is a counselor. Many of his clients are HIV positive because of what he calls HIV fatigue.
There's definitely people who, as part of that's relieved that they've got the disease finally, that these years of either protecting themselves or struggling against becoming infected are over, because it was a tiring struggle.
In the last year, the rate of new HIV infections grew faster among men in their 30s and 40s than among men in their 20s. Tim Marzullo is 35, and his partner Andrew Printer is 40. They've been together for 4 years. Tim tested HIV positive last year.
I remember he didn't believe me. I had to actually have them call and confirm for me because he just didn't believe it. He believed it, but he was not sure. So after all that initial shock went away, you know, I mean, there was no question we were only going to have sex with protection. You know, I had sex when I was 21 for the first time, so ever since I was 21, I've had to think in these terms. It becomes a bit too much, and you know, you start to just sort of let risk slip in, and then when your partner, you know, the person that you share a bed with, is exposed, you know, well, then the risk becomes even greater. Once upon a time, there was something out there called HIV or AIDS, and it looked frightening and grisly, and you were going to die painfully and soon. Now it's not quite like that, which creates this gray area where behavior is altered slightly, with us, with everyone.
It's very discouraging after all of the education that we have done, all of the money that's been put into prevention, you know, to see these types of increases. And it's also very scary. I mean, the disease could really flare up again in the gay population, and we could see this incredible increase, especially in a time when funding is getting tighter and tighter, and drugs are getting more expensive. We just saw this incredible increase in...
Terry Cunningham says 45 new people sign up for the HIV Drug Assistance Program every month in San Diego. Even though condoms are an integral part of the HIV prevention effort, the county won't spend government money on condoms. Dr. Matthews of UCSD says advocating abstinence only is bound to fail.
The reality of the situation is that we are all fallible. You know, if you think about the problems with addiction, whether it's to drugs or to food or to smoking, think about how many people start on a rehabilitation program and relapse, right? Well, when you're dealing with a disease like HIV, one relapse can be the one that does you in.
If I only have 3 more years to live, you know, or if I have 10 years to live, you know, I'm going to try to make those 10 years or 3 years the best, you know. I'm going to try to educate myself, you know. I want to try to help my community. I'm trying to go to college, you know, to study health education 101, you know. I want my family to feel proud of me, you know. I don't want them to feel sorry for me. I want them to look up to me. You know, I have 17 nephews and nieces, and I don't want them for them to happen what happened to me.
Miguel's story is repeated all too frequently in San Diego, especially among people of color. African Americans are hardest hit. Only 12% of the nation's population is African American, but more than half of all new HIV and AIDS cases occur in this community. San Diegans have not escaped this disturbing statistic. Tonight we'll explore this spread of HIV/AIDS locally and what's being done to control it. My guests are Lorenzo Herman, HIV Prevention Programs Coordinator for Comprehensive Health Center, and Rodney Hood, CEO of CareView Medical Group and past president of the National Medical Association representing African American physicians. Lorenzo, let's start. First of all, let me welcome both of you. I'm glad you could be here.
Thank you. Thank you.
Let's talk first about how severe the HIV/AIDS problem is in San Diego's African American community. How does the local picture compare to the national epidemic?
Well, the local picture here is pretty much San Diego County only has about 5.6% African Americans, but we represent well over 15% of the cases of the whole county. And among the African American population here, men who do have sex with other men make up the majority of the HIV cases among African Americans.
And what about women and youths? I mean, how hard are they hit by this?
Women is pretty similar with the national statistics in San Diego County as well. African American women make up pretty much the majority of the HIV cases as well, and also pediatric cases too.
Why is it so high among pediatric cases?
Well, I think that one reason is basically what the CDC had discovered last year with the new HIV prevention initiative, is that perinatal care, as far as making HIV testing part of a routine medical practice, has not been strongly practiced over the past several years. It's not mandatory for women to get an HIV test during while they're pregnant, but we're trying to encourage clinicians to promote HIV testing as part of a regular perinatal care. So I think that we need to provide that service while women are pregnant, to ask them, would you like to take an HIV test?
All right, let me turn to you on this, Dr. Hood. Why do you think that AIDS, HIV has hit the black community so much harder than other racial ethnic groups?
Well, you know, I think it's multifactorial. I think if you look at when AIDS first became on the scene in the 1980s, you heard very little bit of it in the African American community. Sometime in the 90s, it began to take off, even when AIDS was coming down in the other communities, especially the gay sexual whites. However, and I think the reason has to do with socio-economic issues. I think it has to do with myths, beliefs, and religious issues that have made it difficult to kind of penetrate. I think the other issue is that there really hasn't been a focus of resources on the communities with the highest burden of disease to kind of bring in the culturally appropriate educational programs.
So do you think then that that the allocation of resources is the biggest challenge to preventing the spread of HIV/AIDS in the African American community?
I think it's one of the challenges. You know, I don't really think that you're going to pick one thing out and say the biggest challenge is this. I think it's this needs to be approached in a comprehensive way. I think the African American community needs to have more education, more engaged. In our community, one of the most important institutions is the church, and it's been difficult getting the church engaged in this on a very large basis. There are certain churches in the area that have been very progressive, but as a whole, that hasn't taken place.
Is that your experience too, Lorenzo, that it's hard to get the church engaged in fighting the epidemic of HIV/AIDS?
Well, sexuality in the Black church has always been a very sensitive topic. And here in San Diego County, there has been a lot of resistance from some churches as opposed to talking about sexuality, especially when they want to promote abstinence-based only programs, where we also do that too, but we also provide an option as far as safer sex. So we try to offer a comprehensive package for reducing HIV and AIDS.
So what you're really bringing up here, I think, are the attitudes that you find in the community toward this disease. And one of them, I guess, has to do with the church's attitude toward sexuality. What other attitudes do you find in the community toward the disease?
Well, interesting enough, at least from my experience of working here, a lot of the stigma associated with the disease is still the same. A lot of people still believe that HIV is primarily a white gay man's issue. So if you're not white, if you're not gay, or if you're not on drugs, then I'm not at risk for HIV and AIDS. So there needs to be more re-education about the epidemic and so forth.
Is that your experience too?
I think he's very accurate, and that's what I mean by reallocation of resources. It has been shown that when resources were focused on the gay white male community, there was a significant decrease in the incidence of AIDS, although it seems to be going back up. To the degree that happened, I have not seen that happen in the African American community. And when I say burden of disease, in your introduction, you said that the highest rates are in the African American community. Then, although the numbers of African Americans totally may be less than the other communities, I think whatever resources are there, they need to be reallocated, focused on that community, and educational programs that they'll respond to. Some of the educational programs, some of the intervention programs that take place for HIV and AIDS may or may not work or may not be appropriate in the African American community.
Yeah, and I do want to talk more about the resources and where they can potentially come from. But I have another question. Is there complacency going on now that antiviral drugs have become so effective in prolonging the lives of people who have AIDS?
Yeah, I call it the Magic Johnson syndrome. It is true in my observation that since the antivirals and the new regimens have come, and we've seen folks doing quite well, and I mentioned Magic Johnson, who I don't think has ever looked sick for a day, yet everybody knows that he has HIV, it has kind of lulled folks back to sleep. And that goes through all communities. So clearly, I think that has had an effect.
So it's not doing anybody any service then to portray HIV/AIDS as a normal situation?
Well, I think that it needs to be portrayed in a holistic way. HIV still kills. HIV is still a very dangerous infectious disease and needs to be treated that way. And I think we need to get to the point where we treat HIV the same that we treat some of the other sexually transmitted diseases, and totally put it in perspective. The only difference is this is one of the sexually transmitted diseases that still kills, although folks look well. Even if you get it and you get the treatment, there's problems that if you're not getting the right treatment, if you're not getting the right drugs, if you're not taking the medications the way you're supposed to take it, then you develop resistance. Now you got resistant viruses, and this is the main concern. Many folks are now picking up this resistant virus to all these wonderful drugs that we have, limiting their options. When you limit somebody's options, you limit their life expectancy.
Yes, we saw that in the video. The young man, Miguel, had a resistant strain. And we also saw in the video that AIDS is again rising among gay men in the African American community. What are the infection rates among women in the African American community as compared to men?
Well, women, at least in the county, they still make about, I think, approximately about 10%. But just among women nationwide across the country, African American women and also Latinos make up the majority, well over 50% of all the cases among women, and so forth.
Go ahead.
Well, go ahead, finish your question.
I was going to say, what role does intravenous drug use play in all this? I mean, we've been talking, you know, about the sexual component, but there's this other component too.
That is the second highest mode of transmission among African Americans in general. The first one is MSM, sex with men, and then IDU use.
MSM, men having sex with men, right?
Right, and at least among women, you know, the highest mode of transmission is heterosexual contact and then intravenous drug use. We did see some decrease among IDU use in the county in the mid-90s, but it has been increasing according to the 2003 HIV/AIDS report for the county.
So in the African American community, Dr. Hood, what are physicians and health case workers doing to try to control the epidemic?
Well, let me start out by saying not enough. I think that...
and we come back to resources again.
And then we come back to resources. I think that there needs to be more physicians in the community that specialize and treat HIV. I think there needs to be more physicians in the community who are relate to the populations, more African American, Hispanic physicians who actually treat HIV. I have had patients come to me specifically asking for an HIV treater who is African American. I've had to refer them to Los Angeles. There's data that suggests that some people feel better with a relationship with a physician that looks like them.
But what is it that is causing the physicians to resist working with the HIV/AIDS group of people? Why aren't there more people at the port?
To treat HIV is not easy, and it has actually become a specialty. I won't be surprised, and I know there's movement now to make it a subspecialty area in the medical field where you need to take extra training. So it is not the type of disease where you can treat adequately, I think, in a setting like in a general practice. I think the physician needs to be trained, and I think he needs to have an office set up to kind of treat that population. So part of it is that.
So with only a couple of minutes left, Lorenzo, who's at the forefront of the fight? I mean, what is the role, for example, of the County of San Diego here?
Well, the role of the county is to make sure that allocations of money are being disseminated according to the epidemiology of the county. That's disputable whether or not those monies are being spent adequately among people of color. But one of the main reasons why I believe that there's such a huge problem is the lack of people of color who are HIV infected involved in the community planning process. And that's the body of people that make decisions on how funding gets allocated in the county, and we don't have representation adequately to make those decisions.
Why no representation?
Well, it has to do with many different issues. Access to care, also lack of training about the community planning process, and people not being aware of where to go to get services.
Is that what you were talking about in terms of resources not being placed where they need to be placed?
Correct.
Okay.
I think that over the past several years, we've seen a transition of the disease taking off in certain communities. There has not been a transition of resources to follow that increased burden of disease. Okay. And I think Lorenzo was right. Part of the problem is that there aren't enough people of color sitting at the table having this discussion when they talk about where the allocation goes.
So in the last minute that we have left, quickly, what is the hope that this will change?
Well, I think it will. First of all, it must change. It should not be looked at as just an African American or men having sex with men issue, because as we learned before, it will spread outside of that community. As a matter of fact, my concern is that one of the things that the blacks lagged behind on was realizing that it could affect them, as they always saw it as a homosexual disease. Clearly, it's rising in the heterosexual community just as well, and even more. So stressing the homosexual community, I don't think is helpful if you're not including the other community.
Okay, well, I wish we had more time, but we're just about out of it. So I want to thank you very much, Dr. Rodney Hood, Lorenzo Herman. Thank you.
Thank you.
And that's all the time we have for tonight's Full Focus. To learn more about AIDS in San Diego, log on to our website at kpbs.org. And we always enjoy hearing from you. Write to us at the address on the screen, and tune in again tomorrow night for another edition of Full Focus. For KPBS, I'm Gloria Penner. Good night.